To our newcomers, welcome to Cal Poly, and to our returners, welcome back home. I'm Don Oberhelman, your athletic director. Shortly, you'll hear from our sports medicine team what guidelines will be in place for this COVID-19 environment that we find ourselves in. These guidelines have to be followed for a number of reasons. One, so we don't have an outbreak. An outbreak of COVID-19 within a team or our building could lead to a number of you missing practice and competitions, the outright canceling of games, and even canceling of entire seasons. If we have an outbreak, we get shut down. Two, we must demonstrate to the campus that we'll be good stewards of their trust, as athletics is really about the only entity being allowed to return to campus in this capacity. We lose trust, we get shut down. We have an obligation to protect each other, other teams, our staff, your families and friends from the spread. By agreeing to be here, we expect you to honor all these instructions whether you agree with them or not. As we discussed in our team Zooms, whatever parameters get put in place that allows us to practice and compete, we will do. We are all in this together as a Mustang family, so let's be smart, let's be safe. I can't wait to see each of you back at home in our buildings. Thanks, and go Mustangs.
Hey everybody, it's Dr. Corrigan here at the Sports Medicine Center. I'm here to talk to you today about coronavirus. I'm going to hit some of the highlights, including what is it, what are the symptoms, how do we protect ourselves, and what happens if you test positive. So first, what is it? Coronavirus is a virus. It's a very common virus that we've seen for many years. However, this year's version has never been seen by humans before, and therefore our body doesn't have an immunity to it. It's also unique that it, compared to its cousins, the other versions of the coronavirus, it tends to cause more symptoms, more severe symptoms and more complications than we're used to. It's hitting the country quite hard, as you know, with over 100,000 deaths so far. However, San Luis Obispo has been relatively safe, so we're hoping to keep it that way. That's why I'm talking to you today. I want to at least remind you that this virus is quite clever in that it takes advantage of human nature. It takes advantage of human tendencies, meaning that we as humans like to gather, we're social, we like to be around our families and our friends and our loved ones. And what happens with this virus is it infects you, it gets into your body, you become infectious with it before your symptoms even start. And therefore, you're spreading it to your friends and your family and your teammates before you even knew anything was going on, and then the viruses keep spreading that way. And that's why it's a very clever virus, and we have to be aware of that. And so we put safeguards we enact safeguards to prevent that. The symptoms of this virus are typical severe cold and flu symptoms. They cause cough, shortness of breath, difficulty breathing, fever, which is defined by a temperature above 100.4 Fahrenheit or 38 Celsius, depending on what scale you use. Body aches, chills. It spreads through respiratory droplets, which means that the moisture from your mouth, your nose, your phlegm is how the virus spreads from person to person. When you sneeze, when you cough, when you breathe, when you sing, when you pant because you're exercising, that is how the virus spreads from person to person. Because of that, we are recommending that people wear a face mask anytime they're in the public, anytime you cannot be at least 6 feet away from others. We recommend frequent hand washing. We recommend that you sneeze and cough into your elbow, and basically the recommendations are not to be out in social settings if you can't maintain safe distance from other people or if people are not wearing face masks. There are some of us who are more higher risk for this. Those are people who are age 65 or older, for people who have respiratory illnesses such as asthma, or any really chronic illness such as high blood pressure, obesity, diabetes. And this virus seems to be hitting those individuals a little bit harder than people who don't have those illnesses. Now, most of our athletes are young and healthy. However, you have to remember we're working in a big team of coaches, assistants, athletic trainers, physicians, and a lot of people on campus who may fall into those categories. So it's important for us to remember that not only are we trying to keep ourselves healthy, we're trying to keep the people around us and the people who help us be successful each day also healthy. I want to reinforce some of the things we talked about already with protecting yourself. We will be providing some face masks for everyone to wear, and we want you guys to wear those every time you're on an athletic facility, not when you're exercising, however, but when you're walking in the halls of Mott, when you're here in the athletic training room. You'll be using hand sanitizer frequently. We'll be washing our hands for at least 20 seconds. We want everyone to report any symptoms that they're having to the athletic training staff, or to me, or to your coaches, whoever you need to talk to let us know that you're having symptoms so we can take care of you right away. If you do test positive, and we're putting a lot of work into this, but right now we want the athletes to know that there's still emerging data coming out from this virus in young, healthy people. We know that it does affect different organs differently, such as your blood vessels, your heart, your lungs, your kidneys, and therefore, if one of our athletes does test positive, we're going to require that person see me or one of my colleagues here on Campus Health to make sure that they're safe before they can resume practice. If you guys have any questions, of course, athletic training staff is always around, and I'm always around as well. So remember, stay safe, stay healthy, wash your hands, cover your mouth, stop touching your face, and train yourself to stop touching your face. It's a habit that we all do, and we'll be here to take care of you. Thanks.
Hello everybody, welcome back. I know everybody's excited about our return back to campus and to resume practices. So in order for us to do this, there are some things that we have to put in place. So I'm here. The first I would like to bring up is maintaining social distance. This means keeping a minimum of 6 feet away from those people that you don't know that aren't your roommate. The second thing I would like to bring up is wearing your mask. When you're practicing and when you're on the field, we don't ask that you wear the mask. But when you're in the facilities, please maintain social distance and wear your mask where appropriate. The third thing I would like to bring up is bringing your own water bottles and towels. Because there is no laundry service right now during these times, please bring your own towels. And also bring your own water bottles filled. We will supply water, but we're not going to be able to handle your bottles. So please bring your own bottle, label them, number them, do as such. That way you have water during practice times.
Hi you guys, welcome back. I want to let you know what you have to do in order to be able to participate in our activities here on campus. The first thing you're going to have to do is what we call phase 1. In that phase, you have to watch this educational video, so thank you for doing that right now. You're also going to have to do an attestation as you enter the building. That will include your temperature and then also doing a symptom checklist and if you've been exposed or have had the virus. The third part of that screening is going to be actually a large screening where we're going to ask you more questions to identify if you're at a higher risk for your teammates and for yourself. Once you've done all that, then you would be able to be cleared to go ahead and participate in our voluntary workouts. All right, the second thing we need to cover is actually what it's going to look like when you are coming back and participating in those workouts. First thing you're going to have to do is the attestation as you enter the room or enter the field. That's going to be a symptom checklist and also a temperature check. Once you have that, you're going to get a wristband. Once you have that, that's good for that whole day. So if you go from the field to the weight room, that's how it will work. The second thing you need to realize too is that you're also going to be in groups of 10, and it's going to be considered your pod. With your pod group, you will be working out the whole week, the whole month. You're going to be staying in that pod group to help keep our team safe. The importance of the pod is that if somebody were to develop symptoms, the only group that is hopefully affected is that actual pod. Now, as we transition to some different phases, our pod sizes may get larger. So initially, please remember to stay in your pod group of 10 as you go to the weight room, as you go to the field. Also, that pod group of 10, if you're doing extra workouts on your own, try and stay in that.
Cal Poly Athletics. Today we're going to go over some of the rules and guidelines when you get back here and start training on the 15th or the date that you return to campus this summer. A couple things we're going to touch base on. Okay, your group pods. You're going to be put in pods of no more than 10, could be less than that. It is very important that you stay in these pods at all time, whether you're in the weight room, whether you're conditioning on the field, etc. You will move in these pods. These are more than likely the pods you will train with throughout the entire summer. That's important, so we can make sure households are staying together, not worry about spreading and passing it on to other pods, so we can limit if a case does come up, that it's only a select amount of people that are affected by it versus an entire group, an entire team, etc. Also, make sure when you come in, you need to show up no earlier than 15 minutes early to your designated training time. Okay, understand it's not a free-for-all. You come at your exact time of training. If you train at 7, you need to be here by 6:45. If you train at 11, you need to be here by 10:45, prepared at your attestation with your athletic trainer, who will then go through that process and clear you. And once you get cleared, you will know exactly where you're going. Are you going to the weight room? Are you going to the field? Or for instance, a basketball court, and you will go there and you will go to your exact station where your name is at, and you will stay there until you're told otherwise, okay? If you have any symptoms at all, okay, do not show up, contact your athletic trainer immediately, please. Moving forward, okay, once you get done at your attestation, you're gonna go to where you're designated to start at. Okay, understand, once you get here, once you get done at the attestation, there's no high fives, there's no hugging people, okay? You need to maintain the 6 feet social distancing at all times. So understand, all that's out the window and whatnot. And we need to make sure we're doing that so we can keep moving on and progressing towards this stuff quicker and quicker and get back to normal. Reminder, okay, you need to bring your own towel and you need to bring your own water bottle. If you don't have one, we unfortunately will not be supplying them. So if you want a towel, bring your own towel. If you want a water bottle, bring your own water bottle. There is absolutely no sharing. You cannot hand your water bottle to someone. You cannot hand your towel to someone. That is 100% off limits, okay? Cleaning, okay? When you clean, you're going to clean before you touch it, okay? Then you'll use it, and then you're going to clean immediately after, okay? Anything that you use needs to be wiped down, whether it's plates, kettlebells, dumbbells, bands, or whatever. It needs to be wiped down before the next group comes in, okay? If you touch your face at any time during the workout, okay, you must then clean everything immediately after that before you can continue training and progressing into the workout, all right? As far as water goes, okay, when you go to in the weight room, okay, we will have the water station set up, only the push bottle fillable, okay? You will not be able to use the drinking fountain part where you actually go down with your mouth and get it, okay? But before that, okay, it's very important, okay, you will have to sanitize. There's a sanitizing station right next to the water fountain. You will sanitize, you will then fill up your water bottle, and then you will sanitize again, and that is the process of getting water, okay? Understand, our front entrance by the desk is the only entrance and exit in and out of the weight room, okay? The locker rooms are off limits, okay? So you will not have access, both men and women, to your locker room, period, once you get here, okay? And then immediately once training is over, you will be asked to leave the building. We're not gonna hang out in the hallways and that, okay? We will escort you to the outside, and then you will go along with your day. Other than that, look forward to getting everybody back, and we just need to follow these rules and guidelines so we can keep progressing, like I said, and get back into the normal swing of things. Appreciate you guys. Thank you. Have a great day.